Hello, it's Aliona with you. And today we have one of the types of nails that came after surgical removal. The woman has a problem with her nails growing back because for many years she has been regularly and very often covering her nails with gel polish. Or rather, not often, but just systematically. And these nails are not removed, they don't get a break during the winter. And there's a tendency for them to curl not only on the big toes but also on the second and even the third ones. And basically at some point she couldn't take it anymore and went to see a doctor, and they advised her to have them removed. But they didn't remove the whole nail, they just cut out this little edge that was growing in. And now you're watching the removal of what's left of the sore from the sinus, I guess, like this dried up skin. Because in general they removed everything for her, but there's still some inflammation and discomfort. We can also see a small cavity here on the side, but today we're not even paying attention to it. Our goal and task are entirely different. We need to remove the dry crusts that are bothering her, that are causing her discomfort, so it will be easier for her to walk. Because right now, except for open shoes, unfortunately, she can't wear anything else. Because any contact with her toe causes her a lot of discomfort. As you can see, there's a lot that has built up there. And honestly, it's no wonder that it hurts. But I won't say anything bad about the surgeons here. Well, it's okay, they removed it just fine. Yes, they took off half the nail. Yes, now it's probably going to split and grow back a bit separated. But at least if necessary, you can connect it a little with polygel or gel, make a prosthesis and apply a coating. If there's not enough width, it's not enough visually for me. As they say, it's personal preference. But right now we have completely different tasks. We need to remove everything unnecessary, and of course we are removing the length of the free edge, because in shoes it all gets pressed, it all catches on things. And on the other hand, by the way, we also observe the nail growing into the tissue. As you can see, with the help of the curette, you can get a lot of interesting things out of there. This is some kind of substance, a bit with elements of subungual callus. Overall, this is all cleaned out too. It's a shame we lacked time. To provide the full service and do a proper pedicure to clean everything up nicely. I know that you would like to see the complete final result. But sometimes we take clients on an emergency basis during breaks, slightly adjusting the schedule. In general, I want to say that if someone comes in with acute pain and is almost crying, saying they don't know what to do anymore. Of course, we will take them in as an emergency. The best part is our loyal clients always understand and are willing to wait, and we are very grateful to them for that. Well, of course, they feel this way because they themselves were once in a similar situation and someone helped them and accommodated them too. And then, of course, people understand everything. Here we continue the cleanup. By the way, while Master Yelena was working, I was assisting her at that moment, bringing her all the necessary tools. Because, I'll say it again, everything was simple. It was just done urgently and in a hurry. At the moment we're trimming the cuticle, just to open up access a little bit. Although, of course, it wasn't about aesthetics or cleanliness here. We just removed it so it wouldn't get in the way of us looking. Well, I can say that even after these manipulations, the finger already looks quite nice, and you can see which part of the nail the surgeon removed, that is these few millimeters on the side, and accordingly this particular nail on this foot will be a bit narrower than the one next to it, or rather the second one. And most likely now a double splinter like this will grow. Yes, I see there's onycholysis, but that's not today's topic. The main priorities are addressing the inflammation, this little one, and the ingrowth. I can say that even during the cleaning process you can see that the toe has already calmed down. I'm holding the curette for Lena and trimming. Sometimes we have to work four-handed like this, when you just don't have the ability to do it alone. In those cases you definitely need assistance. Actually, we're a team, we're a crew, and together we're strong. And well, it's not that I don't understand, but it's just hard to be a solo master. It's so much better when you have colleagues, when you work in a friendly team like we do, and when you can help each other out, lend a hand when needed. One person is strong in one area, another is strong in something else. And I guess that's why we manage so well. Sometimes one master starts a task, another continues, and then you pass it on. For example, one does the French manicure and another adds the design. Well, it's just because we need to coordinate our schedules. We know for sure that this way will be as efficient as possible. Even with 10 people, the main goal is achieving a great result. But these are just the nuances of how we work in our salon. This is our style of working, and our clients are used to it as well. Why not let another technician handle amazing designs if she's the best in the salon? That way, the client gets the best result. That's it. You can already see the packaging. No smiley faces since we ran out of time. Well, goodbye for now. See you next time.